In the past few years, genetic testing has become increasingly more prevalent in the medical field due to advances in science and medicine. Recently, the radiology office that I work in has implemented genetic testing to assess a patient's risk for breast cancer. We work with a company called Myriad. On their website, Myriad says that 7% of breast cancers is caused by a mutation in the BRCA1 or BRCA2 gene. 87% of the people with this gene will be diagnosed with breast cancer before the age of 70. So the statistics are pretty astounding. This gene is also hereditary, so it means it's passed on from generation to generation, and people with this gene have something called the hereditary breast and ovary syndrome. So it's important not only to get checked for yourself, but also for your children. What we do is we have a patient fill out this questionnaire, and it's not only about their own family history, it's also about their family's history. We ask questions about relatives, aunts, cousins, even males with cancer. We ask about their ancestry, if they have any Jewish ancestry. And not only breast cancer, ovarian cancer, uterine, stomach, colon, pancreatic, these are all risks for having this gene. So obviously it's a very overwhelming sheet, and not every patient knows every single thing about the members of their family, but we ask that people fill that out as thoroughly as they can, because that will help us in the future to diagnose and work with a patient about their results. So we have them fill this out, and then they give us a sample of their saliva or their blood. Usually saliva, because people are not as willing to give up their blood as they are just spitting into a specimen cup. The cup gets sent out to Myriad, and then they test it for these two BRCA1 and BRCA2 genes. So this is important not only for the people, but for the children of the people to know whether or not they're at a risk for breast cancer. It's covered by most insurance companies, especially since they are taking more preventative measures to make sure that people don't have cancer, because it costs them more when the people have cancer. It's the same reason that people are recommended to have mammograms every year after they turn 40. The same reason that everyone is supposed to have colonoscopies every 5 years, that men are supposed to get their prostates checked. And I think we're going to start to see the genetics testing a lot more in the future, because it's such a simple process, and it's cheaper for the insurance companies than paying for imaging of people's breasts and colons. So the patient gets the results within a month, and if it's negative, that means that both sides of your family are negative for the gene. So you don't have it unless you have someone, your spouse has someone that has it in their side, then you can't pass it on. If it's positive, that does not necessarily mean that A, you have cancer currently, or B, that you are automatically going to get cancer. But there are some measures that you can take. You can meet with a doctor, usually your primary care, because the risk for cancer doesn't necessitate you seeing an oncologist. You can also, they'll probably prescribe you with hormone treatments, and an extreme measure is getting a preventative mastectomy. That's removing your breasts and the glands within them, so you cannot spread the potential cells to any other part of your body, because breast cancer gives you a higher risk of other cancers as well. So it's important for you and your children to know whether or not you have this. But like I said, it's a positive result is not a death sentence. It doesn't necessarily mean that you have cancer or will get cancer, but it's a good thing to know, and it's a good way to be prepared. And it's easy. So if anything, it puts you at ease. I think it's a great idea. It puts you at peace of mind, and it can let you know what you're giving to your children as well. So I say, if we have a medical advance, we should use it. Thanks.